Nearly half of U.S. states, 48%, are on the brink of an unpaid family caregiving emergency, according to findings from a new study conducted by Columbia University Mailman School of Public Health and sponsored by Otsuka America Pharmaceutical Incorporated. Now, today I have Dr. John McHugh and I also have Liz O'Donnell. Good morning to both of you.
Good morning.
Morning.
John, let me ask you the question. What is the state of unpaid family caregiving in the U.S. and how does it vary across states?
Yeah, so this research that was sponsored by Otsuka really tried to make the invisible visible and really highlight the immense contribution that families are contributing to our healthcare system. We found that unpaid family caregiving is either critical or at high risk in 24 states. Now, Missouri was valued at $16.8 billion. We categorize Missouri as, let's say, safe for now. That doesn't mean that nothing can be done, but there is a stronger policy environment in Missouri than many other states. We really hope this will serve as a tool to assess the family caregiving landscape at the state level and inform decision-making and political advocacy.
Now, doctor, is unpaid family caregiving on the rise, and if so, why?
It is on the rise, and there are several reasons why. So first, there is a lot of pressure on the paid long-term care workforce, and you really can't decouple the unpaid workforce with the paid workforce. Second, we have an aging population, and an aging population with a lot more complex conditions. And then third, along those lines, there is a rise in the prevalence of dementia care. And we found that nearly half of our national valuation was driven by dementia alone at $340 billion.
Liz, can you share your personal caregiving experience and how it inspired you to become an advocate for caregivers?
Sure. I started out caring for my parents slowly. I call it the caregiver creep now, because I think it's very common for people where your parents start to show signs of aging, they need more support, and so you show up, but you don't realize you've taken on a whole new role and that you've become a caregiver. You just think you're being, a good daughter or a good son. So that happened for a few years, and then there was the crisis. And for me, that crisis was 2 terminal diagnoses in the same day. I found out my dad had Alzheimer's and my mom had stage 4 cancer. So now all of a sudden I have to come up with a plan of care. I have to try to stay employed because I couldn't afford to take unpaid leave. I'm raising kids. I kept a spreadsheet of everything I needed to do at that time, and it peaked at 196 items. And so I was so overwhelmed and I felt so alone. That's what inspired me. I said, when I get through this, I want to do something so no other caregiver feels as alone and unprepared as I did. And so that's why I started Working Daughter. That and trying to make care and career compatible, because it can be really hard to show up for work when you're caring for a parent.
Yeah, I hear you. Now, Liz, based on your experience, what are the biggest struggles caregivers are facing?
I'd say a couple things. One is that the infrastructure is so flimsy, the support around caregivers. It's like a house of cards, and any one thing goes wrong. Like, John was alluding to the pressures on the paid caregivers. Say your home health aide doesn't show up on time or doesn't show up at all. Those are the gusts of wind that just take the whole house down. And then the other thing is this rise in dementia care. Having been a dementia caregiver, I'll tell you, it's next level. There were times when I was caring for my dad that I literally, fell to my knees sobbing. I was just so overwhelmed by the intensity and the responsibility of it.
Doctor, what are the challenges family caregivers experience with workforce shortages?
Yeah, so in addition to what Liz mentioned, a lot of these issues are exacerbated in rural areas. And we found that more than $375 billion of our valuation was distributed across 32 states that have a greater percentage of their population living in rural areas. So these are areas that have higher shortages of long-term care workers and oftentimes weaker healthcare systems in general.
Doctor, what types of solutions could be most helpful to unpaid family caregivers, especially those in rural areas?
So I think we think about this in several different levels. So there's at the federal level, really investing in the long-term care workforce. So better training, higher wages, finding long-term solutions for staffing challenges for both institutional and community-based care. And then at the state level, really advocating for funding to support unpaid family caregiver programs. So that could be financial assistance, training, access to respite care, and other things that can really help support these caregivers.
Liz, what can be done to support family caregivers?
I would say at the, sort of at the individual level, the employer can play a big role. And oftentimes there are supports in existing company benefits packages, employee assistance programs, flexible work programs are really important. Assistance in finding respite care or paying for equipment. That needs to be communicated better and shared so that caregivers who are so overwhelmed, they don't know to ask for this stuff. So that's one easy thing that I think we can do. And then I think support groups are huge. So whether you join a community like Working Daughter, where you have support 24/7 online from your peers, or your employer starts a caregiver group, that can really help with the isolation.
Now, where can people find additional information and resources for caregivers?
Yeah, absolutely. For more information, you can visit OTSUKA, that's OTSUKA-US.com/caregiver.
Dr. Liz, thank you so much for joining us on Morning Blend and talking about this very important subject. Thank you.
Thank you.
Thank you.